different expert networks and try to produce the most up-to-date technical guidance on this subject. So I will start by Lorenzo. Can you?
Good morning, everybody. I'm Lorenzo Subissi, virologist, and currently acting as laboratory and diagnostic focal point for the incident management team.
Good morning. My name is Janet Diaz. I lead the clinical management unit in the Health Emergencies Program, focusing on emerging and re-emerging infectious diseases.
I'm Corey Henderson, and I am leading the project management team. Thank you.
Hello, good afternoon. My name is Melinda Frost, and I'm the lead for risk communication and community engagement. Thank you.
Hello, everybody. I'm Esther Hamblian. I'm one of the leads for the epidemiology pillar. Thank you.
A lot, and we have other colleagues from other departments who are also contributing very actively to this, the response to this event, but they will join a bit later, but you will be able also to ask them a specific question when they arrive. With this, I will start a very short presentation just to highlight the current situation, but also to provide you a little bit more information than what I have been able to provide on the past briefing on Tuesday. So with this, thank you for the slides. Yeah, thank you very much. Next slide, please. So this is just to reiterate that monkeypox is a zoonotic disease, which means that it's a disease transmitted from animal. But unfortunately, we don't know yet what is the animal reservoir for this virus. We know that it's endemic in a bit more than 9 countries in Africa, where we have seen outbreaks in the recent years. This virus is an orthopox virus. It's a virus from the same family as smallpox and also other cowpox viruses. Regarding the monkeypox virus, we have currently 2 clades, and one clade for West Africa and one clade for Central Africa, and those 2 clades are also circulating in Cameroon. Next, please. So currently we have nearly 200 cases that have been reported all over the world, and you have on this map the countries who have detected some cases. We know that this number may increase in the coming days because we are still at the very, very beginning of this event. The first case was notified 7th of May, so it's really it's 3 weeks or no more, and so we know that we will have more cases in the coming days, and WHO will update you as soon as member states are notifying the cases. Next, please. So this is the epi curve that has been put together, really bringing together all the cases that have been reported so far. So you see that depending on the day, we have more or less cases reported. These are due to the surveillance methods that are put in place in different countries. But what is important is just to see that this event is unusual. Usually we have no cases or very sporadic cases that are exported to non-endemic countries, but now we have more and more cases. Next, please. So it's an unusual situation because we have a high number of cases in many countries, more than 20 now, 20 countries in few days. And we have also many unknowns about this disease because we don't know if this unusual situation is due to a virus change. It doesn't seem so because the first sequencing of the virus shows that the strain is not different from the strain we can find in endemic countries. And it's probably more due to a change in human behavior, but we are also investigating this and trying to understand the origin of this sudden outbreak of monkeypox in non-endemic countries. There are also many uncertainty about the future and this disease. About the future because we don't know if this transmission will stop. What we have seen in endemic countries is that usually we have self-limiting outbreaks, and so we hope it will be exactly the same with the current one, but we don't know. And also we don't know the extent of the disease because, as I said, as we ask country to be more vigilant, then we detect more cases. So we hope that in a short time we will be able to tell you, okay, this is probably the situation, but currently we don't know if we are just seeing the peak of the iceberg and there are many more cases that are still undetected in the community. We have also unknowns, as I said, on the animal reservoir. We are still looking at, with our colleagues from FAO, OIE, and other agencies specialized in animal health, if they have more insights on the reservoir and also on the modes of transmission, because we know that it requires close contact between people. Also, we know that objects can be contaminated, but we would like to know a lot more about the risk and real patterns for transmission. We are afraid that there will be a spread in community, but currently it's very hard to assess this risk. We think that if we put in place the right measure now, we probably can contain this easily. So that's why we are making this briefing today, and we are trying to raise the awareness because we are at the very, very beginning, and we have a good window of opportunity to stop the transmission now. We do have medical countermeasures for this disease. There are vaccines, there are therapeutics as well, but those vaccines and therapeutics were developed for smallpox in case of the re-emergence of this disease. As you all know, it has been eradicated in 1978, and since then we have not used those tools. So that's why we need first to look at the licensing those tools for monkeypox and also assess the quantities that are available so that we can develop good strategies with those medical countermeasures. Next, please. So just to give you some insight on what is this disease, because it will be very useful for all member states to know what is the disease to be able to better detect it. So usually it lasts 2 to 4 weeks. It's a mild disease, most of the cases, but it may be we may have severe cases in children, pregnant women, or persons with immunosuppression due to other health conditions. The incubation is 6 to 13 days, but it can be longer. And the typical symptom is that it starts with fever, headache, muscle ache, backache, and fatigue, and swollen lymph nodes. And then it's followed by skin rashes. And so the swollen nose is really a distinctive feature because otherwise acute fever at the beginning may be confused with many other viral diseases, including influenza or parasitic disease like malaria. So it's very important to look at swollen nodes. And then the skin rash also is quite typical. And it begins 1 or 3 days to 3 days after fever's onset, and it's a rash that has different stages. It started with macules, then papules, vesicles, and pustules, and at the end, it crusts that dry up and fall off. The case fatality ratio is not very high because it's between 3 to 6%, but also it depends really the care you can have. And again, as I said, we can maybe access treatment that may reduce this case fatality ratio. Next, please. So there are also tests for this disease, and for us, we really recommend to use PCR. So my colleague here from laboratory can talk about it if you need more information, but you can take sample from skin lesion, from fluid, from vesicles or pustule or dry crust, and then apply the PCR on that. And a sample needs to be stored in a dry, sterile tube and kept cold. So we are developing laboratory protocols for that, and they will be put on the website very soon. Next, please. On treatment, we have drugs that are still experimental because, as I said, they were developed for smallpox, which is an eradicated disease. But thanks to the ACVVR, the group that is meeting every year, a group of experts, they are discussing how to have more medical countermeasures if smallpox re-emerge, and fortunately those countermeasures can be applied also to monkeypox. So Rosamund Lewis is the focal point for WHO on smallpox, and she has also been driving the agenda for monkeypox preparedness for the past few years. So we have tecovirimat, which is an antiviral that has been tested as experimental drugs, and there is another experimental antiviral treatment, NIOCH14, that is also in the pipeline. Next, please. Regarding vaccination, we have a vaccine that were available for smallpox eradication, the first generation of vaccine. Since then, we have had a new generation of vaccine, second and third generation of vaccine, and even more recently, the MVA vaccine. But again, those last generation of vaccine and MVA are experimental because they were tested for smallpox and not monkeypox. Although MVA has been licensed for monkeypox very recently in 2019. Some countries have stockpile of the first generation of vaccine. We don't know exactly the number of doses that are available in the world, and so that's why we encourage countries to come to WHO and tell us what are their stockpile, what are the quantities available, and if they have done potency testing on those vaccines so that we have a better understanding of what are the resources currently in hand. Next, please. Very importantly is infection prevention and control procedures. So you need to protect yourself and others, avoid close contact with people who have suspected or confirmed monkeypox. And then when caring for a person with monkeypox, it's important to cover the lesion, wear a medical mask, avoid skin-to-skin contact, clean hands regularly, and wash clothes, towels, bed sheets, and eating utensils with warm water and detergent. And also clean other clothes and bedding sufficiently, and disinfect any contaminated surface, and safe disposal of contaminated waste. But again, I think this is not a disease the general public should be worried of. It's not like COVID or other diseases that spread fast. So all those recommendations are not to create anxiety in the general public, but it's more to raise the alert and make sure that we all know what is the risk we have in front of us, and we can take the adequate measure in a timely manner. Next, please. So WHO has been working very, very hard to produce some technical information, but also inform all member states under the IHR procedures. And you have here the timeline. I will not go through it, just to tell you that we will continue to work and we will continue to support you the best way we can. Next, please. So for us, we think that the key priorities currently is trying to contain this transmission in non-endemic countries, raising awareness in special risk group, detect cases early and isolate them, and stop change of transmission through intensified surveillance in certain population groups that are more at risk, do cluster investigation and contact tracing, and protect healthcare workers or any health worker that can be exposed to the virus to prevent transmission in healthcare setting or laboratories. For this, we have also we are developing a case reporting form. So if member states can please notify to WHO and use this form, it will be very useful to better understand the disease and also the characteristic of the patient and see if we have a specific high-risk group. We are also developing standardized clinical protocols so that we can collect data in a standardized manner across different countries and regions and compare the data. And we are also providing guidance to adapt and strengthen care pathways and with appropriate IPC measures so that a patient can receive the best care possible. Next, please. Then it's very important to communicate about this event to avoid panic, of course, stigmatization as well of certain population group, and reduce already impact on society. We don't recommend travel bans or restriction, and we need to continue to communicate about what we know, what is being done, and really reassure the public. The point is that we need just to take the right measure. And it's a third point, we need risk-based strategies, meaning that the strategies and the intervention should be commensurate to the risk. And we need also to, if there are possibility to use vaccines or treatment, it has to be used taking into account the public health needs and be very wise in the use of those countermeasures. We will need also global collaboration. Please continue to share information, diagnostic resources, data. Try to use standardized protocol as much as possible so that we can compare data between countries. And please work with WHO so that we can have a global response to this event, and we are coordinated and we make sure that there is an equitable access to countermeasures based on public health needs. We have a virtual stockpile for vaccine, and we also encourage countries to tell us they made some pledges a few years ago, so we would like very much to revisit with them the status of those pledges and see how we can access vaccines and antivirals with those countries. And we need also to accelerate the research agenda for monkeypox, and my colleague Anna Maria, I don't know if she's in the room, yes, she's here, will talk more about it if you wish, about the consultations she's organizing. And finally, it's last but not least, very important that we strengthen the One Health approach in endemic countries, and our partner agencies and other stakeholders working on One Health are encouraged to also reach out to WHO so that we can have a strategy for the coming months on this aspect. Next, please. So this is about the acceleration of the research agenda, and Anna Maria may talk more about the R&D blueprint consultation which will take place next week. Next, please. And I just would like to thank you for your attention. So now the floor is yours for questions and answers. Thank you very much.
I just want to recognize and thank sincerely our interpreters who stayed on to do the interpretation during this. So thank you so much for your efforts. Really appreciate it. And just to introduce Dr. Anna Maria Restrepo, who arrived while you were speaking. Anna Maria is the technical lead on the WHO blueprint for R&D for epidemics, which is co-led by myself and Dr. Sumia Swaminathan, the chief scientist. Thanks.
We see that a question from Chile. Please, you have the floor. Chile.
Gracias, buenas tardes, colegas. ¿Puedo hablar en español, cierto? Vale, entiendo que sí. Muchas gracias. Buenas tardes a todos. Primero agradecer a todo el equipo de la OMS y a todos los que están trabajando sobre esta nuevos casos que tenemos. Una pregunta simple. La OMS está pensando tener sesiones informativas seguidas sobre este tema como tuvimos en un momento con COVID. ¿Piensan hacer sesiones semanales, cada 10 días o todavía no lo tienen pensado? Es un poco también para saber y comentar con nuestros colegas en capitales cada cuánto tiempo podemos tener información actualizada sobre lo que está pasando. Muchas gracias.
Gracias. We have not yet planned this session, but we can see with our colleagues from governing bodies if they agree to support this event. I think we will finish the WHA and then we will keep you posted. There will be regular information through the IHR channels, through the ICE and also the disease outbreak news. So we will keep you posted on the latest evolution. Thank you.
And we're also very conscious of the demands of the time, particularly on the missions here in Geneva, so we're not trying to overload. If there is a demand for informal technical briefings bilaterally with groups or with all of the member states, we're very happy to do it, but we're also very conscious of the time. We can certainly do virtual briefings, which may be a lot easier to organise and sustain, which national experts can join. So we welcome the Member States' guidance as to how frequently and what type of briefings would be most helpful.
So we will take, for the interest of time, we'll take few questions and then do a roll answer. So I would like then to give the floor to Uruguay.
Gracias a la mesa por compartir toda esta información tan valiosa. Dos preguntas muy concretas, tal vez tres. En Uruguay estamos comenzando también a diagramar una propuesta interna, país, del formulario de notificación y de investigación de casos. Y en ese sentido nos gustaría poder contar con apoyo, así como tenemos la definición de caso sospechoso, en tener una definición de contacto en la medida de lo posible, ¿verdad? Porque eso va a ser una construcción que iremos aprendiendo todos. Después, lo otro tiene que ver con las medidas de control. Me gustaría poder escuchar si pueden compartir los países que están, lamentablemente enfrentados a este problema, sobre la aplicación de las vacunas como medida de bloqueo y de control. Cómo hay que implementar esa estrategia de vacunación como medida de bloqueo. Y en ese sentido también preguntar los países que, no tienen stock, cómo pueden hacer, cuál es la logística, si debemos referirnos a las representaciones regionales, así como también el tema diagnóstico, en acceder a los primers para diagnóstico. Muchas gracias.
Gracias, Uruguay. I would like now to give the floor to Brazil, followed by Zambia, and then we will answer the question. Thank you. Brazil, you have the floor.
Brazil, yeah. Mr. Chair, I'm the Secretary of Health Surveillance from Brazil, and I would like to point out that Brazil has established a situation room to monitor the cases. And so far, there is no confirmed case in our country, and we already have our surveillance network active. For this reason, I'd like to share with this information with all of the member states. And my questions for the Secretariat is, who would be the target population for a possible vaccination campaign? Thank you so much.
Zambia, you have the floor.
Much, Secretariat, for the informative session. I just wanted to ask about the vaccination. Is the Secretariat now considering vaccination for endemic areas as well? Thank you.
Thank you. Maybe I give the floor to Rosamund for answering those questions, and for the laboratory, Lorenzo may want to add. Thank you.
Thank you very much for the questions. Regarding the definition of contact, I encourage you to consult already two documents that are available online. One is on contact tracing, investigation, and isolation, and that one is already there. Of course, these are very interim updates that were put up within a matter of days, and we will be taking consultations from our expert groups and updating as needed. The second one that's already online, as was shown in the slide, is the how to do laboratory testing for monkeypox, and again, that will be updated quickly, but there's precious information there already for you on the WHO website monkeypox health topic page. In terms of the rest of the questions, they were primarily around immunization and vaccines. So we do have, as Dr. Briand mentioned, one vaccine that is approved for monkeypox. It is approved in two regions, the United States of America and Health Canada. It is not yet approved by other stringent regulatory authorities. It is a new product. It is the result of decades of research on smallpox countermeasures. And as far as we know, smallpox countermeasures may be protective against monkeypox, but you can imagine that there's not been time to do a lot of research, certainly nothing on smallpox in the last 40 years in terms of human studies, clinical trials, and field studies. There are human studies, but there's safety and immunogenicity studies. What I mean is that we don't have field studies and large-scale clinical trials for these products. So this product is new. It has been approved. It does not have WHO pre-qualification status at this time. It is something that WHO, of course, was already working on, but activity will need to be accelerated. So at the moment, the technical advisory group around smallpox and monkeypox vaccines was already scheduled to meet. So that meeting was brought forward, and we do have guidance. It is not yet online, but we do have guidance from the SAGE ad hoc working group on smallpox and monkeypox vaccines. What we have been advised so far is that there is no need for mass vaccination. There is no need for large immunization campaigns. This is a condition, as described by Dr. Briand, that is transmitted primarily by close physical contact, skin-to-skin contact, face-to-face contact, and therefore contact tracing, investigation, and isolation remain the primary modes of control for the time being. This is really critically important, that not everybody who needs isolation will be able to attend hospital services for that, and isolation at home will be a very important mode of control for this condition. In terms of the guidance around target populations for vaccination, we have WHO has already put out in 2013 guidance for prevention of orthopox virus infections for people who may be at risk, who are laboratory personnel. So that guidance is not new. It has been there. It is available on the WHO website. It can be provided since 2013. It was not specific to monkeypox, but it did mention that for preventive purposes, people who are at risk from an occupational perspective may wish to consider these immunization products. So that includes laboratory personnel, health workers, frontline health workers, and or first responders. However, this is of course subject to advice from the National Immunization Technical Advisory Group in each country. So we strongly urge each country to also convene its own National Immunization Technical Advisory Group. In terms of managing contacts, so right now we're also receiving guidance from our expert group on managing contacts. So anyone who is has been immediately exposed as a direct contact through close contact, face-to-face, skin-to-skin contact would be considered a contact. In countries where a vaccine is available, these persons may be considered for post-exposure prophylaxis. In other words, given a vaccine after they have been established as being contacts. So the short message is that immunization is in a very restricted contact circle at the moment for any case. However, also at the present time, these vaccines are not widely available. Work is being done already as we speak, as you can imagine, to improve this situation. So at the moment, vaccines are not widely available, but where they are available, there will be guidance. And in the meantime, case investigation, contact tracing, isolation at home will be your best friends. Thanks.
And for endemic countries, the same protocol.
Thank you for the reminder. Yes, so for endemic countries, similarly, this vaccine has been under studies. There are studies in northern DRC underway using the very same already approved monkeypox vaccine. It's a study in health workers. But aside from that, there are no vaccine reserves available in countries for monkeypox because this is a new product. At the moment, there is not a recommendation to use smallpox vaccines for monkeypox. There may be some exceptions in some countries who have reserves and already have guidance in that line, but by and large, this will have to be discussed at national level, and we will be providing guidance on that as well.
Lorenzo, can you quickly give some update on diagnostic, and then I will give the floor also to Anna Maria to talk about the research on those products. Thank you.
Thank you, Dr. Briand. So there is an increasing number of PCR tests that are becoming commercially available in the market, but those ones are really for research use only at the moment, and their performance needs to be verified. Meanwhile, we have convened a global laboratory network, and as mentioned by Dr. Briand and Dr. Lewis, we have released the first interim guidance on laboratory testing for monkeypox virus.
Before Anna Maria, Mike would like Anna Maria first. So, okay, Anna Maria, sorry, and then Mike who wants to add something on the vaccine.
Sylvie, can you hear me? Okay, so 3 points. The first one is the consultation on June the 2nd and 3rd is open to everybody. So the member state representatives are most welcome to join us during this consultation, where we intend to discuss all the evidence that exists, the gaps of knowledge, and the priorities for research on all the topics Dr. Briand has referred to. Number 2, as it was mentioned, we have some medicaments, some therapeutics, and some vaccines that have been licensed, but we all recognize from the Secretariat and our expert groups that it's very important to use the opportunity of these outbreaks to learn more about their efficacy and safety. So we encourage all the member states to please join us in the Secretariat to work in a coordinated way to gather information on these drugs while they are deployed and on these vaccines while they are deployed. We have to learn not only on their efficacy and on their safety, but also on the best way to deliver them in the field. And number 3, there will be other discussions in other research priorities beyond vaccines and therapeutics. Some of them have been mentioned: the reservoir, the laboratory tests, the ways the virus is transmitting in the endemic countries and outside the endemic countries. So to the question of what will happen for the endemic countries, I have the pleasure to confirm that several epidemiologists, researchers, and clinicians from endemic countries will join us on June 2nd and 3rd to present their experience and the research they are conducting. Thank you.
Yes. Just to second what Anna Maria said about trying to work together to gather structured information so we can learn more about the virus, its transmission, and the impact of therapeutics, and also the best strategies to use. 50 years ago, we used a ring vaccination strategy for smallpox, but the majority of cases of smallpox were essentially in rural areas, so there was a geographic ring in a village. But we know that in the global village, we don't interact like that. So contacts are very often more in social networks, not necessarily in geographic networks. So in Ebola, for example, ring vaccination doesn't mean a geographic ring, it's a social ring of contacts around the person. So a contact could be someone who's already 50 kilometers away who has spent time with that person, or 500 kilometers away. So contact tracing in this context has evolved. Ring vaccination has evolved. We have to look at Ebola. We vaccinate contacts and contacts of contacts. And that contact of contact vaccination is highly effective in shutting down transmission. We don't have the answers in monkeypox to what would the most effective strategy be, and that's why Sylvie speaks to the need to be able to understand those strategies. What we have are good, well-proven strategies, but they may need to evolve. And that's why the scientific collaboration around that, the gathering of data and information. Similarly, we've never had therapeutics before that we could introduce into the system. We always had public health measures and vaccination, but not effective therapeutics. We have therapeutics now, which can be used to save lives, but also can be used to help reduce infectivity of infectiousness, and may help also in public health control. With those vaccines and therapeutics, it's very important that we have learned from COVID how to pool these resources. We have multiple international coordinating mechanisms for vaccine products, for cholera, for Ebola, for yellow fever, for meningitis. These have been amazingly successful mechanisms where those who hold vaccines are able to share them with countries that need them, and have proven life-saving in so many different contexts. These vaccines are distributed on the basis of need, not on the basis of ability to pay. We know a number of member states have very wisely invested in stockpiles in case of smallpox, and there are vaccines available that are licensed for monkeypox and similarly therapeutics. We will and are and will be working with those countries to see if we can make good on many informal arrangements over the years for the sharing of those products. We would like to see a coordinated mechanism whereby countries can access vaccines and therapeutics through a mechanism that's efficient, that's fair, that's equitable, but also recognises that mass vaccination is not the target here. We're talking about providing vaccines for a targeted vaccination campaign, for targeted therapeutics. So the volumes don't necessarily need to be big, but every country may need access to a small amount of vaccine. So the Secretariat offers itself to provide that mechanism and coordinating platform to work between those who have and those who haven't got the necessary products. And we would very much thank those countries who do have stockpiles, who have engaged with us previously over the years and are engaging with us right now to try and find solutions for this issue. Back to you, Sylvie.
Thank you very much. So we don't have much time, so what I propose is that we take all the questions for the remaining country. We have 6 countries that have requested the floor, and then we will try to answer them here, but otherwise my colleagues are here and can stay in the room, and you can come and get answer to your question. I would like to say also that Meg Doherty and one of our colleagues has joined us. She's the director of HIV. I can't remember all the disease you are covering, but she can also answer your question if needed. So the next countries are Gambia, Monaco, Norway, Singapore, Lithuania, and Latvia. So Gambia, you have the floor for your question.
Thank you very much, Madam, and we thank you for the insight into this monkeypox. Actually, I just wanted to put forth some few questions and concerns. Initially, the question will be, what indicators are there with regards to its zoonotic origin? Because probably that's helpful. Already, probably you've had some indicators. The second issue is with the issue of the endemic countries. What was being done for those countries? Because it's just only now that we are hearing so much about monkeypox, but apparently it had been endemic in some other countries. The global community, WHO, what strategies had been put in place? You go, when there's endemicity and it is not controlled, you know, and we have recurrent outbreaks, probably it's a matter of time before we have a pandemic. So these are my comments and questions. Thank you.
Very much, Gambia. Gambia. I have also 3 additional countries, Finland, USA, and Madagascar. So next one is Monaco, please.
Je vous remercie et merci pour ce briefing et ces informations. Tout d'abord, si nous pouvions avoir la présentation qui soit distribuée par mail, ce serait extrêmement utile pour transmettre dans nos capitales. Deuxièmement, je vais rebondir sur ce qui a été dit par le Chili. On voit dans la presse, on voit dans les médias, on parle beaucoup de cette variole du singe, on parle beaucoup aussi des adénopathies chez les enfants, par exemple. Et quelque part, la presse va plus vite que l'OMS ou que l'information que vous nous donnez. On a vu avec le Covid à quoi ça pouvait mener. Donc si je sais que c'est un effort que vous êtes mobilisé sur le terrain pour avoir des réponses, mais le plus d'informations que vous pourrez mettre sur le site et nous donner à nous États membres, hors des réseaux points focaux RSI, le plus ce sera utile pour que nous puissions répondre. Merci beaucoup.
Merci. Then is Norway.
Thank you, and I would also like to thank you for the information. So 2 questions on my side. So if it's the same sequence virus, do we still expect the same mortality? Because in one way you say this is a mild disease, but 3 to 6% mortality is really quite serious, especially in the young population. So, and my other question is sort of what are your theories on why we're seeing this in so many countries across the globe? So how did this happen? Thank you.
Thank you very much. The next one is Singapore. You have the floor.
Thank you very much, Dr. Brian. So similar questions on epidemiology. First, to confirm the understanding that in endemic areas in Africa, it's mainly sustained by zoonotic spillovers rather than human-to-human transmission. And if so, then the question would be whether it's a question of research or whether it's known whether there are rodents in Europe or outside of Africa that might be capable of sustaining endemic transmission in animals. The third question, of course, will be then whether there's known human to animal transmission that might possibly seed such transmissions. I understand that this might still be a question of research, but what is known about these issues will be helpful. I also echo the request for slides to be sent to member states. It will be very useful. Thank you.
Lithuania, you have the floor.
They may have left. They left.
Hmm?
They left.
The left, okay. Latvia.
Thank you, WHO, for this technical meeting and guidelines which are published. And we agree that it is important information of public at this moment. And after COVID, we receive a lot of questions about decontamination measures in households. And therefore, we would like to ask, are you going to publish some recommendations for public about decontamination measures in case of infection in households? Thank you.
Finland.
Thank you very much, and Finland thanks the Secretariat for organizing this meeting. We have a comment about the communication with missions. So we do not need any regular communication, but we believe that a virtual meeting now and then, when you have new information, would be useful, because then we can benefit from the questions of everybody, and you don't need to repeatedly answer them. Second, we would very much appreciate that when there's something significantly new, that we get the brief before the media, because our experts have to respond to the questions of the media immediately after WHO publishes the information to the media. So 1 day before would help us very much. Thank you very much.
US.
Yes, we'd like to join others in thanking the Secretariat for this very helpful briefing and join the call for additional information sharing. But I would like to follow a little further on information. There is a fair amount of misinformation already, and if you could talk some more about what WHO is doing or what resources might be available to counter that misinformation. I think this is a particularly acute issue regarding stigma for certain populations. So if you can maybe comment on that as well. Thanks.
Thank you. And last, Madagascar, on my list at least. Madagascar.
Merci pour la parole. Nous félicitons l'OMS pour cette présentation qui est concise. En fait, ma question repose premièrement sur les techniques qui sont actuellement mises en œuvre donc pour le diagnostic de cette maladie. Est-ce que ce sont des techniques fait maison ou est-ce que ce sont des kits fabriqués avec des amorces concoctées par l'équipe de l'OMS? Si c'est le cas, quand est-ce que les techniques seront disponibles sur le site pour que nous puissions faire le diagnostic dans nos pays respectifs, mais surtout pour que les techniques soient homogènes dès le départ, pour qu'on puisse aller au séquençage ou autre technique, puisque de toute façon actuellement on entre déjà dans l'ère de ce séquençage. Je trouve qu'il est important d'harmoniser les techniques dès le départ pour pouvoir suivre l'évolution de la maladie. Merci.
There was also Turkey wanted to take the floor.
For giving me the floor. My question is, how many days do you recommend for isolation of the contacted cases? Thank you.
The interest of time, because we were asked to leave the room at 12:50 and we have reached the time. So we have taken all your questions. What we propose is that we can answer those questions, have a statement or something that will be distributed to GBS, to the missions, so that you can have answer all of those questions, because we cannot answer them. But if you have more time, because I understand that we need to finish this meeting now because there are other meeting planned within the WHO. So, but if you want, our experts are here. So if you have specific question, I'm sure they can stay 10 more minutes to help you. But we will do it outside because I think the room has to be freed up. So sorry it was a bit short, but we will keep in touch with you all and continue to send you information as we get it. Thank you very much.
Might I just add, for the question about the public versus the other information, we always put our information in more detail on the EIS platform well in advance of disease outbreak news. So I think it's important that the IHR focal points in each country are circulating the EIS information throughout the system, because huge efforts are made to put detailed information on the EIS platform in advance of publication in any form of public domain. Thank you.